I am Kellene Diana, and I am the proud founder of the Green Heart Community Incorporated here in Baltimore City. We provide resources, support, and green love for those healing from anxiety and depression. Today, I had the honor to interview our mayor, Brandon Scott, on his vision and the direction of mental health here in our city. Our organization, the Green Heart Community, will be lighting our City Hall's dome green on May the 1st, Saturday, May the 1st, to kick off Mental Health Awareness Month. So I just wanted to ask a few questions to our mayor to see, what are some things we can look forward to for our children, employers, as it pertains to mental health as they go back into the classroom and things of that nature. So stay tuned to listen in on the interview. I'm sure he's going to be answering some questions that you may even want to know the answer to. And then if you would like to see how you can get involved with the Green Heart Community, feel free to email us at info@thegreenheartcommunity.org. Thank you so much, and green love to you. All right. Hello, Mayor Brandon Scott. Thank you so much for joining me. It is such an honor to have you, excuse me, have you with me today. I really do appreciate it. Last year, I met you when we were on a mission, right, to bring awareness to mental health in our city, in Baltimore City. So I'm so honored to have you back here to discuss the same thing, especially now because of what's going on in the world. The conversation needs to be held now more than ever. So last year, the Green Heart Community had the privilege to light Baltimore City green to bring awareness to the importance of mental health in our city and the world. So this year, as you know, May the 1st, Green Heart Community will be lighting Baltimore City Hall's dome green again from May 1st through May 4th to bring awareness to the importance of mental health once again. So I'm so glad that you're here with me again, because I know that you're such an advocate for mental health. So together, I just want to take this opportunity today to ask you a few questions about the direction and things as it pertains to mental health. Last year, we did like a whole event, and you came out and you spoke, and we had speakers and singers. It was beautiful. But this year, because of COVID, we're here. But I'm just grateful for virtual technology so we can make this happen. All right, so I want to honor your time. So I did reach out to my community and polled them and asked them some, if they had any specific questions that they would want to ask you as well. And I have my own personal questions. So we can go ahead and jump right on in. All right, so the very first thing I want to ask is, with such an uptick in anxiety, depression, PTSD, because of the impacts, of course, of the pandemic and the blatant racism that we're seeing, that our kids and teens are witnessing on a daily basis sometimes, what plans are in place to normalize addressing their mental health as they return to the classroom? Because there are it's such heaviness that they are carrying. I have a daughter who's going into high school, and some of the things that she's witnessed, that she's experienced over the last year, and I've seen her struggle and ask questions that I don't even have the answers to. So I want to make sure that when they walk into that classroom and they bring that heaviness, what's in place that's going to assist them, and the staff as well.
No, thank you for that. And thank you for having me. I wish we could be in person again. I know that was a great event. I had a great time. And we all know that right now, even more than ever, that we're dealing with racism and mental health simultaneously in our everything that's going on. And we have to do that work of supporting Black mental health through advocacy and policy change.
Yeah.
Sorry about that. And for us, the big thing that we're going through right now as a city government is that we are implementing the Trauma-Informed Care Act, the Elijah Cummings Trauma-Informed Care Act, where we are now training city employees. We started with me and my agency heads. I'm going to work through every single city employee to make sure that they are trained in trauma-informed care, to make sure that they're meeting the needs of everyone that they interact with. And that's not going to be this kind of deep systems change work is not going to happen overnight because it's a lot of people that have to be trained and a lot of policies and things have to put in place. But we have to start somewhere. And we were starting from zero. And that's going to seep its way into our communities. We're going to be working with our schools and our other quasi partners to look at that as well. And we also have a trauma-informed care board, task force that I appointed and sworn in. They're going to do the deep work, working alongside our health department and others to see how we can be a trauma-informed city in every way from a city government standpoint.
Okay, so will those trauma-informed specialists, will they be in the schools as well? Like, as you know, will they have an office where, like the guidance counselor? Because I feel like they're going to need the guidance counselors, but they're also going to need something else. The guidance counselor is probably going to be overwhelmed. So will there be those trained trauma specialists in the school systems?
Yeah, for us, it's about making sure that we partner, right? We know that I don't directly have control over the schools. We're going to partner. We know that Dr. St. Elise's and the school board also believe in trauma-informed care practice.
Okay.
We do a lot of that work already. And what we're always going to do is make sure that our health department and our agencies are supporting and being there to make sure that we're having them have the impact that they need as well.
Okay. That sounds great. That makes me feel a lot better. Just knowing that you guys are just so on it, as it pertains to mental health and getting, the proper training for our leadership. So thank you so much for that. So what mental health protocols will employers adopt to identify and treat mental health issues when employees return to the office? Because, the kids and teens, they're going through their own thing. We're going through our own thing. Just everybody collectively is something that we've never experienced before. So, going back to work, are they required to take some additional training, or is anything going to be added to our jobs to be able to accommodate mental health concerns?
And I think that you bring up a great point. And I think that what you're talking about is going to be a part of this greater, really reimagining what the workplace looks like, right? Because it's not, a lot of people aren't going to return in person. A lot of people are probably going to still work from home. And we have to think about how that connects to all the what we call the traditional HR functions that would include people's mental health. For us here in the city, those are the kind of things that we're talking about and putting in place. This is why we're trying to expand our work, and this is why we're talking about the training for our employees, so that we know that people can catch and be there to folks to the assistance programs and things that we have here. But when you think about that for private businesses, that's a discussion that we have to have, not just in a city sense, but really in a more global sense. And we'll start here by working with our businesses, because we know that this has changed. COVID has changed the world forever. We are never going to go back to that world. And we have to think about that, even in a long-term sense of, if someone who has worked in the office for 30 years is now going to spend their last 10 or 15 years working, never coming into the office, or very rarely coming to the office, we have to think about that from employer standpoint, and what that means for your employees' health and mental health also.
Yeah. Absolutely. Yeah, I know me personally, when the whole George Floyd thing was going on, I could not work. Like, I just told my boss, like, hey, I need a couple of mental health days because I got to process. I have to process what's going on top of the pandemic, on top of protecting my daughter's mental health, on top of trying to figure out how to answer these questions, and, it felt really good that my employer said, go ahead and take a few days, so I think that's so important that employers know that, and I came back, I was still bothered and still very disturbed, but I needed that time to process. So I was just so grateful for that. So I think a lot of employers need to really look at it from an employee standpoint and them as well. I mean, this doesn't impact just the employees, it impacts, the CEOs and all of the leadership, and so it's all of us. So so yeah, just like you said, the partnership and the training, I think is major, is major. So that's awesome. So number 3, what resources and funding will be allocated toward mental health in our city, and how can someone access it?
Yeah, I think that first, let me say that there's much out there already. There are always grants that don't just come through the city. A lot of it comes to the health department from the state and the federal government, and that gets granted out there. We also now know, as we look at funds that are coming in from our wonderful new president and vice president, and what might come to the city, there's going to be opportunities for people to apply for that kind of information once we get the guidance from the federal government about how we can spend it, which they haven't given to us yet. And it's really about a continuance of reimagining how we think about people's mental health and people's safety in our city. And we look forward to expand that.
Okay, awesome. Question, so 911, like, is there, or is it anything in the future or coming down the pike where it will be a specific emergency number for mental health crisis instead of like a 911? I know we have 211 and I think 311, but is anything specific for that?
So you're going to get an early secret. It won't be a specific different number, but what we're going to be building here is what we call 911 diversion. So that when you call 911 for a mental health or a substance abuse or issue, that you're not just getting police, right, or fire, but you're actually getting connected to service providers who are trained in that arena so that you can get the help that you need immediately. And that's what we're working to build here through our 911 diversion. It's actually also a part of our consent decree that will reduce burden on our police department in that way. And I would just say, you'll hear big moves on that in very, very short order. So just stay tuned.
That is awesome. That makes me feel really good. When I used to struggle with anxiety really, really bad, I used to call 911 all the time because I would always think that it was something medical wrong. But it was it was all the time. And the protocol when I would call 911, they would cause more anxiety with the types of questions and things that they ask, and it didn't have anything to do with how I was feeling. So I would just hang up, or sometimes the ambulance would come, and it was never any kind of I just never felt safe, or I never felt like I was taken care of. I felt misunderstood, and I wish that I had somewhere or somewhere to go, or somebody to talk to that can truly understand my breakdown at that time. So that personally makes me really happy to hear that you guys are on top of that. And my community is going to be amazed to hear that as well. That was actually one of the questions that the community had asked as well. So yes, that's awesome. So you kind of talked about this already, but what's the overall vision and direction for mental health in the city?
Yeah, it's first understanding and really recognizing mental health as a deep issue in our city. That's first. We haven't been a city that has comprehensively thought about health and safety, right? They thought about health and safety as you and I just discussed. You call 911, you're having a mental health issue, a mental health episode, as some people like to say, and you get police or fire. And that's the exact opposite response that you should get. But that's the way Baltimore and really most cities have thought about that for many, many years. What we are undertaking is what I call the responsible reimagining of public safety in our city. And that's why we're going to be looking at these issues in their totality, thinking about how we are trauma informed, thinking about how we respond differently, thinking about how we build up infrastructure for organizations to be able to impact those kind of mental health issues, because they are a direct link connect express bus, M3, whatever you used to catch back in the day, to violence in our city. And we have to make sure that we are breaking that connection by dealing with the issues at the ground level.
Yes, yes, awesome. Yes. And then last but certainly not least, well, actually, I have two other questions. So, one, what would you say to those struggling right now with a mental health issue? What would you say to them to encourage them to keep fighting for their goals and dreams in spite of their mental health concerns or issues?
First thing I would say is that you are loved and that we love you and we want you to be here and be able to achieve your wildest dreams. Second, it is okay to ask for help. In
Yeah.
particular, I want to say that to the men and black men in particular, that it does not make you less of a man to say, I need help, or to talk about your feelings or what you're going through, or to say that I am not right. My mind state is not where it needs to be. And for
Mhm.
you to get help, that makes you stronger. Weaker
Mhm.
is allowing that to consume you or allowing that to cause you to harm yourself or people around you that you love. But lastly, is that you will no longer be invisible. Mental
Yeah.
health will be a visible thing here in Baltimore for us to attack as long as I'm sitting in this chair, and together we will tackle the issue.
That's awesome. That's great. And how, I mean, you can't be more visible than lighting the entire city dome green, right? So I'm just so honored that we're able to do that. And I want to ask, like, how can organizations like the Green Heart community partner with the city to help with, making your vision happen?
Yeah, I would say the first thing is to be a part of this reimagining. If you go and look at the Mayor's Office of Neighborhood Safety and Engagement, and their website is just simply monse.baltimorecity.gov. They are embarking upon right now a tour around the city to talk about this comprehensive approach to dealing with violence, which includes mental health. We're building that framework now, and we want the community to be involved in that, because we are no longer going to try to dictate to the community what happens. We're going to build with the community how we are handling those issues, which is the most important part.
Can you say that website one more time?
Yes, ma'am. It's monse.baltimorecity.gov.
Okay. Okay, perfect. And one thing that I wanted to just say real quick, like you said, if you need help, I just want to say this for our viewers. Um, See, me, I struggled with anxiety for a very long time, and my mom's prayers was the foundation of my healing, but therapy was my healing place. And seeking a therapist doesn't make you crazy. We got to get away from saying that word. It makes you responsible. It makes you responsible to yourself and to the people who love you. So, I just wanted to put that out there because seeking help is very attractive. It's very attractive and it's necessary for each and every one of us, especially now. So Brandon, I'm sorry, Brandon, Mayor Scott, do you have any last minute things that you want to say to our viewers, to my community?
Well, first and foremost is a thank you, and thank you for having me. Thank you to the community for caring about people in this way and being there and showing up for people in this way. And that I look forward to celebrating with you guys next year in person again.
Yes, I cannot wait for that. Now, do you remember last year we did a pledge for the city? We did, like, we looked at the dome, we locked arms, and we said the pledge. So can I say it one more time and you repeat after me?
I can do that.
Okay. And for our viewers, you can repeat after us as well. So this is the Go Green Pledge. And it is: anxiety and depression will not have our city in 2021.
Anxiety and depression will not have our city in 2021.
Anxiety and depression will not have our jobs in 2021.
Anxiety and depression will not have our jobs in 2021.
Anxiety and depression will not have our households in 2021.
Anxiety and depression will not have our households in 2021.
Anxiety and depression will not have our schools in 2021.
Anxiety and depression will not have our schools in 2020.
Anxiety and depression will not have our children in 2021.
Anxiety and depression will not have our children in 2021.
Seeking help is okay.
Seeking help is okay.
Going to therapy is okay.
Going to therapy is okay.
I deserve to heal.
I deserve to heal.
My children deserve to heal.
My children deserve to heal.
And as a citizen of Baltimore City,
And as a citizen of Baltimore City,
I commit to seeing this through.
I commit to seeing this through.
By making my mental health my priority.
By making my mental health my priority.
Because it starts with me.
Because it starts with me.
All right. So thank you so much, Mayor Scott. Green love to you. And I thank you so much from the bottom of my green heart.
Thank you. See you later.
All right. Have a good day. Bye-bye.